Hello guys, in this video we are going to discuss about status epilepticus. Right, this particular topic I have studied from Zanovora's ma'am video and I am going to teach you the same thing only. Okay, so what is the first line? What is the first line treatment of status epilepticus? Many of you will say IV benzodiazepine, but you will get it wrong. Right, the first line treatment of status epilepticus is airway breathing and circulation management plus 2 IV line placements. Right, so this is the very first thing you will do. If they ask you what is the first line drug, then you will say IV benzodiazepine. Usme bhi kya? Lorazepam. Right, lorazepam you will say. You will say lorazepam. First drug, then it will be Lopez or lorazepam. Lopez is nothing but lorazepam. Right. Then if it doesn't stop even after that, what will you give? You will give phenytoin. Right, phenytoin. Okay, after that, if it even doesn't stop even after that, you will give IV midazolam or IV propofol. What is important to remember over here? IV propofol. Right, IV propofol. And even if it doesn't stop after that, then we will give pentobarbital, not thiopentol, pentobarbital. Right, pentobarbital. We'll give pentobarbital. And after that, if it doesn't stop even after 48 hours, we say it late refractory seizures. Right, status we will give various type of things like ketamine, etc. You don't actually have to remember these things. So this is done. This particular topic is done. Only these things are important. First thing you have to do is airway breathing and circulation management plus 2 IV line. Second important thing about it is what is the first drug that will give? Lorazepam or Lopez or other benzodiazepine if it is given in option. If it doesn't act or it is not useful, then we will give phenytoin. Right. Other things that may be asked is valproate or levetiracetam. So always look that if phenytoin is not given in option, then what will you give? Valproate or sodium valproic acid or levetiracetam. Okay, if it is not controlled within 5 to 30 minutes, then we call it established or early refractory seizures from 30 minutes to 2 days. From 30 minutes to 2 days, it is called established or late refractory seizures. That's status epilepticus. In such a case, you will give IV midazolam or IV propofol. Right, you can also give further IV anti-epileptics just by giving above. Okay, after giving IV midazolam and IV propofol, if it is not stopped even after 48 hours, we call it late refractory seizure. In this case, you will give pentobarbital. Right, pentobarbital. Right, so this completes our whole topic. And even after that, if it is not controlled, we will give anesthetic drugs like ketamine, etc. So we have completed this whole topic. It is very easy. And apart from that, there is one more thing I think I should tell you, which is also told by Zanovora's ma'am. When to stop. When to stop anti-epileptic drugs. When to stop drugs. Right, when to stop drugs. Very important. Seizure free period should be more than 2 years. Right, seizure free period should be more than 2 years. Means that, for example, a person with seizure is taking anti-epileptic drugs and he has been or she has been seizure free. For example, the question is telling you since 1.5 years. So will you stop the drug? Your answer will be no. You have to wait for 6 more months, because you will only stop any anti-epileptic drug if the duration is more than 2 years of seizure free period after taking the drug. Right, other criteria are also present, but this is the most important thing. Other criteria are normal neurological examination findings and EEG. Right, normal neurological examination findings and EEG. Also primary generalized epilepsy. If the patient was having primary generalized epilepsy except juvenile myoclonic epilepsy, in such a case you will not stop. Right, so these are the features. Most important is the seizure free period. That's it guys, thank you.